21.
Good morning, and thank you all for tuning in to watch the Martinez State of the City address. My name is Julie Johnston, and I'm the president and CEO of the Martinez Chamber of Commerce. Normally for this event, we would be getting together at the Creekside Church and enjoying breakfast, networking, and listening to this presentation. However, due to the COVID-19 pandemic, we are coming to you virtually. I would like to thank our event sponsors, MCE Clean Energy, and the Contra Costa Association of Realtors. Thank you for helping us deliver this important program to the community. We appreciate the following dignitaries and elected officials who are here with us this morning. We have Cora Young, representing Congressman Mike Thompson, Ron Turner with Senator Bill Dodd, Jenna Elkins with Assembly Member Tim Grayson, City of Martinez Mayor Rob Schroeder, who is here in the studio with me this morning. We have Vice Mayor Debbie McKillop, City Council Member Lara Delaney, City Council Member Mark Ross, and City Council Member Brianne Zorn. If I missed anyone, my apologies. We really appreciate you for tuning in and for viewing with us this morning. A big thank you to my board of directors with the Martinez Chamber of Commerce. This past year has been a year unlike no other, and I couldn't be able to manage the chamber or do my job without their support. So thank you to my board. We have our chair of the board, Adam Hoffer with AAA Insurance, my past chair of the board, Laura Philpott with Eco Services, our treasurer of the board, Rod Garza with Shell Western States Federal Credit Union, Shelby Taylor with Kaiser Permanente, who is also here with me this morning and is our guest speaker. We have Wyatt Lee with Eco Services, Brandon Matson with Martinez Refining Company, Colleen Holsinger, Angela Larson with Allied Residential, and Mike Manning with Keller William Real Estate. Again, thank you all for taking the time to tune in this morning and to listen to our presentation. Without further ado, it's my pleasure to invite our guest speaker, Shelby Taylor, RN and Site Director of the Martinez Kaiser Medical Offices, up to the stage.
Thank you, Julie. Good morning, everybody. It's my honor to be here today. I was thinking this morning as I was getting ready, what a difference a year makes from where we all were last year when we were in the church together, gathered around eating breakfast together, and not knowing what we were in store for with this upcoming year. Like many other industries, we've been very impacted, as you might imagine, in healthcare when it comes to COVID-19. So today I wanted to go through a few things just to talk about what we're doing in healthcare during this pandemic, because it has been a very interesting year for all of us. So we'll go over our integrated approach that we utilize at Kaiser Permanente. We're going to talk about how we are providing safer access to care for our patients. Also discuss increasing access to our supplies and for testing capabilities. And then also what we do around surge planning, knowing that we've already experienced several surges and unfortunately unknowing if there's more to come or not. And then of highly interest, I know, is around vaccine distribution regarding the COVID-19. So we'll go ahead and get started. So Kaiser Permanente has been around for decades. Our experience in confronting highly infectious diseases has prepared us for this pandemic. During this last year, we have evolved quite a bit of our policies and our procedures to help really make sure that we can provide safe care for our patients. We've been able to work in partnership with our state and local health officials and amongst our entire Kaiser network so that we were able to share best practices and really take care of our members the best way as we could. This coordinated effort really provided us the ability to provide a response that was able to do everything from getting masks and gowns to timely and correct placement of ventilators, building cohorted units for isolation so that we could provide care for our members who have COVID-19, and at the same time protecting our healthcare workers and other members so that they were protected from the exposure while they were receiving their own care. So providing safer access to care was vitally important. In the very beginning of the pandemic, we saw a lot of people that were afraid to go to medical centers for medical care. So we had to do a lot of changes. For years, we've been doing telehealth, which might be video visits with your doctor or telephone appointments with your doctor. Before the pandemic hit, we were using about 15% of our appointments were using those capabilities. At the height of the stay-at-home orders around April of 2020, that increased up to 80% within days. So having that infrastructure in place was critical to providing care for our members. Likewise, we did other things to help provide care for our members in different unique ways. For example, in Martinez, we provided flu vaccinations through a drive-through system for the first time. We did nearly 60,000 vaccines in just a matter of a few months, and we were able to do that with people safely in their cars. Additionally, one of the huge things that we've done is really increased our capacity of mail order pharmacy. So a lot of people need medications on a very regular basis. By utilizing the mail service, we were able to have them shipped directly to their homes. It's also just much more convenient. Our utilization of that program has increased by 96%. At first, I can tell you amongst ourselves, we were a little hesitant and worried and concerned about how our members and our patients would respond to talking to their doctor over a video or talking to them via phone or getting their prescriptions by mail and not coming in. And we've actually had really remarkable feedback from our members about just how convenient and easy it really is. I project going forward that a lot of our members will continue to access their healthcare in those ways because of the convenience for them. Vitally important, I'm sure you've seen a lot of it on the news when the pandemic first hit, was really trying to secure personal protective equipment for our healthcare workers. We absolutely needed that to be able to take care of our members and still keep our workers safe. So we really worked hard to increase our supply, especially around masks, not just N95 masks, but all medical masks, and also the gowns that we need to wear to take care of our patients. We did this by expanding our suppliers. We had teams of people that went out and procured those supplies for us and worked very hard at that, but it was it's a huge lifesaver. At the same time, we really worked with our teams to conserve the PPE as best as possible so that we weren't, that we're being very mindful of our resources that we had given to us. Additionally, we've increased our testing capacity. In the beginning, sometimes it was very hard to get testing for COVID-19. Now it is increased significantly. You can typically get an appointment within 1 to 2 days. For Kaiser members, you can go online to our websites. You can call your physician. You can call the advice center. We can get you in. Typically, results right now are coming back within a day to 3 days, so very fast. We do provide testing for patients who are feeling symptoms of COVID-19. We also provide it for patients who are asymptomatic but are essential workers. And then also for some of our long-term care facilities, the residents, we go out to them and we do weekly testing with them to make sure that those facilities stay safe as well. Martinez is also one of the testing facilities in our area for COVID-19. We have a drive-through system that works very well to help take care of our members. COVID-19 surge planning. So throughout the year, we've had multiple surges, as we like to call it, where we have seen a huge increase in patients who are unfortunately contracting COVID-19 that need medical care. We have gone after this in multiple ways. One of the biggest things that we do is we help to prevent the spread by using tools in our community and public health, which includes identifying new cases, all that testing I was talking about, providing care for those who need it, and preventing new infections. It is important that we respond very quickly when we see outbreaks and respond to them. Like we talked about the long-term care facilities, really trying to make sure that if we have any patients that are coming down with it, that we are able to go in and take care of the rest of the members and prevent exposure as quickly as possible. We've also developed our delivery system of care to be a little bit different. As I mentioned before, we have specific COVID-19 cohort units in our hospitals that allow our physicians and our treatment teams to provide care for those patients. They're very highly trained on how to minimize any kind of potential exposures to others. So it allows our teams to work safely and also maintain the safety of other patients while they're in our hospitals. At the same time, we are ready for any further surges should they occur. We have expanded our treatment capabilities, and we've included, including our treatment spaces, our staff have increased, our supplies have increased, and we are fully open right now. Our emergency rooms are open, our medical office buildings are open, and we do all that while still maintaining social distancing measures. As I said, we have evolved a lot during this last year. So we do have screening at all of our medical centers to provide, making sure that we have minimizing the risk of exposure to everybody coming into our facilities and to our coworkers, but we are here and able to provide care for our members. Vaccine distribution. So I know this is a hot topic right now. There's a lot of interest in it. If you've watched the news at all lately, you've seen a lot going on around this. Since March of 2020 last year, Kaiser did partner with Moderna to work on phase 3 of the trials. And we've also worked with Pfizer and with BioNTech as well with our research teams. And by doing so, we were really proud that we were able to provide a diverse community of participants into that, which is really important to help minimize the discrepancies in medical care amongst our minority groups. By doing so, we've also helped to get those vaccines out there. So currently, Kaiser Permanente is using Pfizer and Moderna vaccines. We're highly optimistic that in the next few weeks, we'll have more options as well. It looks like Johnson & Johnson and AstraZeneca are moving right along with FDA approval. Once those do get approved, then our teams at Kaiser work with the research teams to decide what's best for our members and the way that we can deliver those vaccines to our members. Currently in this service area, our vaccination sites are at our Antioch and Walnut Creek medical centers and also our Dublin medical centers. We have been told, and we're very optimistic, that the state will be providing more vaccines to Kaiser. Unfortunately, in the beginning, there was just not enough supply for everyone, including Kaiser. But it looks like our supply is going to better meet our member capacity. And so in the next few weeks, we're looking to open up more facilities, including Martinez. We're looking at opening that up to be a mass drive-through vaccination center as well. If you're interested, you have questions or concerns about it, there's information on our website. You can also call our call center. You can email your doctor regarding it. They can provide that information for you. Currently, we're following the guidelines with our state and county officials to vaccinate our members who are healthcare workers, for those that are 65 and older, and residents of our long-term care facilities. So we are actively going through and looking at our members who are over the age of 65. We are prioritizing our patients who have complicating medical health concerns already, and also those that are at a higher risk of contracting the disease. So we're working with them, and as we get more vaccines, we will increase that vaccination. We are committed to vaccinating our members as quickly as possible and doing it in an equitable way and following all of the guidelines. So again, as we get more, we will provide more, and we really want people to, you can follow along on our websites. There's lots of information out there, but most importantly is to get that vaccine when your time is up and is available. As we talked about, the vaccine efficacy and the review that we've done with it does show that it's highly effective. So we do encourage everybody to do it. As we move forward in healthcare delivery, we are continuing to come up with ways to vaccinate our members safely and as quickly as possible, and following those guidelines. Last but not least, unfortunately, this pandemic is not over yet, but we can all do our part to help stop it and slow it as fast as possible. And even if you are vaccinated or not, we really encourage everybody to maintain their social distancing, frequent hand washing, and wear your mask. So we can all get back to a state of somewhat normalcy that we are all looking forward to. Thank you very much for your time, and it's been great seeing you all again.
Good morning, everyone. Welcome to the Martinez State of the City Address. It's my honor to serve as your mayor and to update you on all that has happened in the last year and things that we have planned for next year. I'm trying to get the, there we go. 2020 was the year of COVID. Last year, I spoke about all the plans that the city had for progress and moving forward, but COVID arrived and everything changed, creating an economic challenge for the city, local businesses, and everybody's way of life. The city responded in several different ways. We waived water penalties and waived water shutoff. We did not shut off anybody's water. Outdoor dining and flex spaces fees were waived, and the COVID outdoor dining program was launched. We stopped enforcing parking meters, and city business at City Hall continued, although by appointment only. Operations such as planning, building, inspection, public safety, water, park and road maintenance continued behind the scenes. We built specialized web pages to keep our residents informed, which included resource centers for small businesses, the senior community, family recreation, and COVID-19. City operations were changed to meet the challenges of the pandemic. We implemented remote operations as much as possible. Work schedules were changed to minimize staff, to minimize personal contact. All public meetings, starting with city council meetings, commissions, committees, workshops, all went to virtual platforms. It's important to note that City Hall operations continued even with $800,000 in staff reductions. If you attended the State of the City address last year, you saw Commissioner Andrew Dunn of the Pecos League announce the return of professional baseball to Martinez. It was only a few weeks after that announcement that COVID took over our lives and the 2020 season was forced to be canceled. However, I'm pleased to announce that the Martinez Sturgeon is ready to return for a 2021 season. There are 4 teams in Northern California, which includes Martinez, San Rafael, Santa Cruz, and Monterey. All of our major projects that I outlined last year were delayed. The waterfront marina master plan and the trust land use plan did not happen. Annexation outreach as required by LAFCO did not occur. The long stalled general plan update, which is 48 years old. Can you believe our general plan is 48 years old? That was stopped. And COVID dominated all of our other city resources. However, some progress was made in 2020. The first retail cannabis operation opened Martinez. Also approved was a second retail outlet, a non-storefront retail and delivery, and a manufacturing operation. Proposition 68 grant proposal was completed and submitted to the state. If approved, this could bring in up to $6 million for significant improvements at the waterfront and the marina. And after years of negotiations, the city purchased the building surrounded by Lot 4. We relocated the tenants and the building was demolished in July. This will serve as additional parking spaces in our downtown in the short term. And in the longer term, there are a lot of different ideas that different people have, but there'll be some kind of development on that site. And thanks to Martinez voters that improving Measure D, which is a half-cent sales tax dedicated to paving streets and roads, we completed over $5 million of paving work last year. At the most recent city council meeting, we updated and approved the road improvement schedule for the 21-22 year and the 5-year rolling schedule. At tomorrow night's city council meeting, we will be authorizing bid advertising of over $6.1 million for the 21-22 year. This is a combination bid with the cities of Clayton and Pittsburgh joining us to obtain economies of scale. Over the last several years, it became apparent, well, I think I went one too far. This is slide number 10. Over the last several years, it became apparent that many of our street trees, I'm having trouble here, sorry guys. I'm trying to get to the next, oh, here we go, okay. Over the last several years, it became apparent that many of our street trees in the downtown were distressed and needed to be replaced. Limbs would fall on vehicles from time to time and would then be removed. Unfortunately, several people were injured during a downtown event when a strong gust of wind took down one tree. For public safety reasons, city crews removed many trees that pose hazards, making the downtown core look a bit stark. After extensive outreach to businesses and residential communities, 2 species of trees were selected to replace those that had been removed and those that need to be removed. Just last week, street trees in the 400 block of Main Street were planted on both sides of the street. This will continue up Main to Court, and on Ferry Street throughout the summer and the spring and summer. The city is now focused on the revitalization of the downtown core and then the success of businesses in all parts of the city. The outdoor dining program is continuing, and we will be expanding outdoor dining opportunities by providing K-rails to businesses. This is also an important safety measure for outdoor diners. We can't, to help small businesses survive, the City Council approved the Small Business Recovery Program. This is a micro grant program with a total of $300,000 authorized by the City Council, with $100,000 allocated for the first phase. Applications are currently being accepted. The program also includes a marketing program to bring in more customers to our businesses. Social justice. The City Council approved the creation of a new community task force, an anti-racism and discrimination and pro-inclusion and equity task force, also known as ARDPI. This is to address implicit bias and systemic racism in the city programs, policies, and procedures. The City Council is committed to develop the right approach and broaden our outreach based on community input from last year. We must have a task force that all of Martinez can get behind and address the issues of social justice. 2021 will be our year of recovery. We will move through what we hope will be the reduction of COVID-19 and a return to normalcy. We're going to restart stalled projects. We're going to start working on new initiatives, and we're going to restaff many important city positions. So first, we're going to move through COVID. We're going to have a community-wide vaccination. We're going to support business through small business recovery programs. We're going to work with the school district to support reopening of our schools. We're going to open the senior center and get our seniors back together. And we're going to open City Hall and other city services. We're going to restart stalled projects such as the general plan, the zoning code update, the downtown specific plan, annexations, the waterfront plan, and the trust land use plan. New initiatives that we're going to be looking at is downtown beautification, new street trees, better garbage receptacles, such as the Big Bellies. We've got 3 of those downtown, which are wonderful. Refresh, clean, and refresh and clean the sidewalks and public spaces. We're going to launch the ARDPI task force and start with a facilitated community listening session. We're going to develop a new city council district boundaries based on the 2020 census and reevaluate how the city does business. Focus on changes that improve customer service, and some changes made in COVID may become permanent. 2020 will be a year of recovery. We are a strong community, and before this year is out, we will have persevered through the pandemic, and we'll be restarting our economy and lives. We will also be taking a hard look at who we are and how we can improve for the betterment of all. So with that, I'm going to ask that Chief Sapal take over and talk about the police department after we sanitize.
All right, good morning, everyone. I'm Manjeet Sapal. I'm the police chief for your police department, and I have the distinct pleasure every year of talking about the Martinez Police Department and all the wonderful people, both sworn and non-sworn, that do a fantastic job each and every day serving our community. So this is something that I'm passionate about and I really love, and it makes it kind of easy. So today, my goal is really to provide you with a brief overview of the police department. I'm going to talk to you a little bit about policing through the pandemic. What does that mean, and how did it impact us and public safety? And then we'll talk a little bit about homelessness, which is a pretty important topic, not just for us as a city, but for the region. So let's talk about the police department. Just in terms of a general overview, there's 3 distinct areas of focus within a police department. The first is patrol, and these are the folks that respond to calls. So when you call for an emergency, you call for a non-emergency, you need some police service, it's the first responders that show up in uniform to problem solve and work with you through that. And that can result in a variety of different outcomes. It can mean that they provide some guidance. It can mean a referral. It means they make an arrest or follow up with an investigation. And they're the most visible aspect of the police department. And I think to a degree, probably one of the most important parts of a police department, because no matter what happens, pandemic or not, When you call the police, you expect someone to respond. And these are the folks that do that, excuse me, each and every day. Now, in 2020, we had about 34,000 calls. That breaks down to about 93 calls a day. So the officers are fairly busy. And in general, what they do is they have certain areas they patrol. So they're out, providing a visible presence. They're responding to these calls. They know of neighborhood issues that they'll follow up on as time permits, such as traffic violations at certain intersections and looking for and responding to crimes. So they do a really phenomenal job each and every day being out there serving our community. And then we have our investigations folks. And these are the folks that kind of work behind the scenes. They're detectives. They follow up on crimes and investigations. They work with the district attorney's office to seek charges against offenders, to hold them accountable. And we had some challenges this year because of staffing and movement within the organization. We typically have 4 detectives and a supervisor. We dropped down to 2 and a supervisor for parts of the year. But these folks, they kept working hard and doing the job that they're supposed to be doing, and they really focused more on felony cases, some of the more critical investigations. And in 2020, we had about 2,700 investigations. And then we have our support services division, and these are the folks that you don't typically see, but they do an amazing job behind the scenes to ensure that we can continue to provide services every day. We have our dispatchers, the unseen heroes. When you call the police, whether it's 911 or a non-emergency, someone has to pick that phone 24 hours a day, and it's our dispatchers. And then we have our folks in records. They do a fantastic job. Generally, they're interacting with folks in the lobby. They do a lot of stuff behind the scenes with data entry and mandated reporting to the Department of Justice that we have to do. And without them, we'd fall out of compliance in a lot of different areas and get ourselves into trouble. And as a police department, we really try hard to avoid that. So over the course of the year, I want to talk a little bit about some of the promotions that we made. And I think this is really important for a couple of reasons. One, we had 3 sergeant promotions. On its face, that might not seem like it's a huge deal, but considering that we have 6 sergeants, about 50% of them are new. And these folks are critically important in any organization. These are the frontline supervisors. They interact with personnel. They kind of take these broad goals that the public and the council want to see accomplished, and they help operationalize them. Someone has to take these ideas and sort of translate them into something that people can see, touch, and feel. And if it's customer service, for example, and more in community engagement, these are the folks that are out in the community making that happen. And so the sergeants direct a lot of that, and they really bring this different and unique perspective, because we all bring a certain level of value to the workplace based on our upbringing, our culture, our education, and who we are. And I'm really proud that the 3 folks that were selected this year just shine in very different ways. You have Sergeant Zach Lexi, who was promoted. Last year, I think I talked about a really involved drug case, and then he was one of the main detectives that was behind that case. We have Sergeant Gerardo Espinoza, who was also the Officer of the Year for 2020, does a fantastic job. And then we have Sergeant Rodney Brinzer. Many of you probably know him because he was our community resource officer, and he did a lot of work with our homeless population. And they, all these folks, they bring in these unique skills, and I think it's really important to highlight that it's these folks that really help push the organization forward. And as I talk more today, I'll kind of explain what that means. In terms of staffing, we hired 6 people, 6 officers since the last State of the City address. I think that's really, really good. We're always looking for talented and caring and service-oriented folks. So if any of you are interested in a job or know someone who's interested in a job, please refer them our way. We want to make sure that we're trying to get folks that really care about our community. And right now we have 1 vacancy for the police department for the sworn folks, which, considering a few years ago we were really struggling with staffing, is pretty phenomenal. But I will say that we still struggle at times because there are certain things that we can't predict. We can't predict when officers get injured or when they're sick. And when we have these vacancies for those reasons, we just have to work through those. And currently we have a couple of vacancies for folks that have been injured or on long-term sick leave. And we're just gonna have to kind of work through that. And it means that everyone else who's here in the police department, both sworn and non-sworn, have to step up and just do more. Wear multiple hats, take on more shifts, But in the end, we're going to continue to do what we do to keep the community safe. So what happened during the pandemic? How did it impact policing? Well, for us, early on, like everyone else, we were trying to figure this out. No one had a playbook. And we were really concerned that if we end up with any officers that get sick or get exposed, it's going to have this chain reaction through the organization, and you could potentially wipe out these patrol teams, these folks that are supposed to be out serving us every single day. And so early on, we started this emergency staffing. We tried to structure it in a way where people were working a certain number of days and then they were off. So in case they got exposed, the time that they're away from the organization would be almost enough to quarantine. But we learned really quickly that it just was not sustainable. It was going to be too expensive. I think it's a pretty big demand to ask people over a long period of time to just uproot their lives and go to a different schedule, because police officers and the non-sworn personnel are no different than anyone else here, right? We have families, and we have young kids in school, and we have bills to pay, and all the other stressors that everyone else deals with. And so we have to try to find that balance. But I tell you what, our folks never complained. They stepped up. They tried to plug in those holes as best as they could, but it just was not fiscally sustainable. And so, like everyone else, we had to kind of step back and go back to the drawing board and really look at some of these other things, sanitizing the building, making sure that we have proper protective equipment available for everybody, socially distancing. And these are some of the things that we just had to implement and get more consistent with over time. And I think even when the pandemic passes to a degree, we're going to look at these things as kind of a necessity. And in some ways, it's really important, especially for the police officers that are out there and they're interacting with people all throughout the community. One of the things we're really cognizant about is we don't want to be carriers of the virus. We don't want to, make contact with folks and then sort of spread this out throughout the day. If you're handling 93 calls a day, you're potentially coming into contact with at least 100 people. And we wanted to be really careful about that. And then on top of this, in the background, there were a whole host of changes with the justice system that really are beyond our control. Courts were closed. They're only handling certain types of cases. That's still in effect now. There were COVID outbreaks in the jails, and so that required some changes in their acceptance policy for arrestees. They were only taking violent felony arrests or domestic violence arrests, and that fluctuated. Sometimes the jails were essentially closed. Sometimes they were open. It really depended on how they had to manage the COVID outbreaks in their own facilities. And the DA's office was limited in terms of filing charges. So you've got all these things happening in the backdrop, and we have to sort of balance the needs of everyone involved. But I will tell you this, irrespective of what happens in the background, we're going to continue to do our jobs. And if that means that based on policy, all these changes, that we can't actually physically take offenders to jail, we're going to issue them a citation. We're going to do our part with the investigation, and we're going to send it over to the district attorney's office to seek charges, because we know that there's certain aspects of our profession, of this job, that we have to do to keep the community safe. And we're never going to shy away from that. Those are absolutely critical. At the same time, we've got to work with all our justice partners to make sure we're doing our piece, so we're not overburdening or causing problems with the system. So, as I mentioned, we're going to keep doing our part. I think the biggest downside that we had with COVID is this lack of social contact. Social contact, this ability to connect with the community through community meetings or coffee with a cop, national night out. They're extremely, extremely important, because that's really where we build those relationships outside of this construct, this concept of responding to a call. Generally, when we show up for a crisis, it's usually not the best time to try to develop a relationship. We're trying to work through a problem, and sometimes people are upset, or they're emotional, or there's some kind of trauma involved. But outside of that, one of the most important things that we do is we build relationships. We have to connect with the community. We want to make sure that those relationships are based on trust. And I think to a degree, making sure that we're being good listeners. And that was really hard to do this past year because of the pandemic. And so I think one of the things that I really hope we can get back to is, in some way, shape, or form, being able to connect with the community. Policing is not something we can do via Zoom. It just doesn't work. I think as an administrator, there are certain things that yes, I can do via Zoom over meetings. But for the folks that are out there serving the community, they have to be out there to touch and feel and smell and see, and actually be part of that solution. And so we don't have that luxury. And so, you know, I would just ask that as we work through this, just be patient with us, and we're going to continue to do the best we can. And the last thing I'll mention is the county health orders, which you know, have been challenging, and really our focus has been on trying to ensure that we're educating the community and we're working with them, because everyone had a difficult time. Everyone's still having a difficult time, and we can't forget that we've got to have some level of understanding and care, because you're all part of one community. So I want to highlight some crime stats, just to give you an idea. Over the course of 2020, if you look at 2020 versus 2019, we had about a 10.5% reduction in violent and property crime for some of these major categories that we report to the Department of Justice. And overall, our violent crime categories were down about 16%. Property crime was down about 9%, and overall about 10.5%. So relatively good. You can see that our vehicle theft numbers are fairly high. They went up about 57%, something that we struggle with over the course of the year. We're going to do two things this year to sort of help stay on track every month with these crime stats. One, we're going to post these every month on our website so they're accessible to the public. And then two, we're going to work through implementing some software that will allow the community to map crime in their neighborhoods. So you can essentially go back 3 days or 7 days or 30 days and look at the crimes that are occurring in your neighborhood. And this is really important because we have to rely on all of you to call us when you see something suspicious. Be aware of what's going on in your neighborhood, and pay attention, because we can't be everywhere at once. And the other part to this is for our own purposes, getting a better handle on where these crime trends occur, and then trying to disrupt them early on, rather than waiting at the end of the year and seeing that we've got an increase or a decrease. We need to start doing this on a regular basis, and that's just got to be a part of our focus of using data to respond to some of these issues in the community. So let's talk a little bit about homelessness. 2020 was a very unique year because a lot of what we do with the homeless requires contact. It requires, you know, building trust and relationships. You've got folks that have been homeless in some cases for many, many years, and you know, part of what we do is try to steer them and gear them towards getting help. 2020 made that challenging because of the pandemic, and it took a couple of months for all the systems to kind of figure out how we were going to continue this mission. And over the course of the year, our core team, which is coordinated outreach, referral, and engagement, it's the county team that we contract with that comes out to do outreach in our community. They contacted about 375 people. It's about a 25% decrease from 2019. They were able to help 28 families. That's a pretty significant increase. I think it's sort of troubling when you think about the number of families out there that are struggling and vulnerable, given you know, the stark economic realities based on the pandemic. And overall, they had about 1,300 contacts, about an 18% increase since 2019. If you look at the folks in our community that are homeless, I think this is important because you really think about the vulnerability of the folks in our community. A bulk of the folks out there are between 25 and 61 years of age. That's shifted a little bit because a couple of years ago, most of our homeless folks were over 55. So we're starting to see this different population emerge. You've also got about 18% that are seniors, over 62, vulnerable population, a smaller group of minors, and then transitional age youth. These are kids that are coming out of foster care or state custody that are facing some challenges with homelessness. If you were to do a deeper dive and start looking at some of the data in terms of who the folks are and what they're suffering from, about 66% of the adults had at least one disabling condition. And if you look at the two main categories, you're looking at mental health conditions and chronic health conditions. And this is important because some of the folks that are out there are really struggling. And if you think about it from a police perspective, you know, we're not mental health specialists. We're not physicians. We're not you know, trained in many ways to deal with a lot of these underlying root causes. But the beauty is that we're not alone in this. And as I go through this, you'll kind of see some of the collaborative efforts and some of just the amazing groups and folks that are out there that are trying to make a difference in our community. When you look at our data and you try to map out, some of the outcomes and really what's going on with the folks that we're contacting and touching, about 24% of the folks that we work with end up in emergency shelter. And that's been challenging too because of the pandemic. The capacity has been limited for the shelters and care centers because of the social distancing. About 5% exited directly to permanent housing, which I think is fantastic because that's the ultimate goal. And 2% ended up with a medical or a short-term care facility setting. About 86% of the folks we come in contact get emergency supplies, and that can be food, water, sanitation kits, some of the basic things we need to survive. About 13% got healthcare coordination, and about 11% ended up in warming centers. Length of time for homeless. This is an interesting slide because in general, for our community, historically, most folks had been homeless for 5+ years. And now we're starting to see this shift. There's about 39% of our folks out there that have been homeless for less than a year. And what that says is that because of these dynamics with the pandemic, you're starting to see more and more people become homeless. And really, part of our challenge is trying to get folks help before they end up on the street. So when you look at some of the eviction, protections and the moratoriums, this is really important because once people end up on the street, it becomes really, really difficult to get them back on track for a variety of different reasons. And so, when you talk about outcomes and where you can make the impact, that's where we try to leverage resources. And part of that is out of our control, but it means making sure that when we're aware of something, we can pass it on to our partners to ensure that they're following up. And sometimes that means that we've got to be the squeaky wheel and really advocate for people. And as you notice, we still have a significant number of our folks that have been homeless for 5 or more years. And the longer they're homeless, the more and more difficult it is to connect them with services. So when I talked earlier about what this all means for the police department, a big part of this is collaboration. It's about working together with all these other entities to have better outcomes. And one of the things that we've been working on was the shower program that really was the brainchild of the Bay Church in Concord. They built this trailer. They wanted to come out and be able to offer showers to the homeless. And over time, what that's done is it's allowed multiple entities to come together to provide really this one-stop shop where folks can show up. They can get a shower. They can get a meal. They can get folks that will help steer and advocate them into services. They can get medical care. This is huge. In fact, Contra Costa County Health Services used to have their medical van show up. Now that's transitioned over to John Muir, but they show up and they provide on-site, medical care for wounds and vaccinations. And I mean, this is fantastic because some of these folks are not going to go to a hospital or to a medical care facility. And since 2019, August of 2019, we've been able to provide 963 showers. And I'll tell you, from having gone down there and watching this in action, just the change it makes with people in terms of their confidence and their willingness to trust us and listen and try to get into services is a huge benefit for the community because once we can get people into help, we could work towards getting housing, but they're not going to do that unless they have some level of trust. And the folks that are involved in this, I mean, just kind-hearted, caring people that are out there trying to do the right thing for folks that are very, very vulnerable in the community. And as far as homelessness goes and the pandemic, one of the questions that pops up is about homeless encampments. Why are we not abating those? Why are they remaining in place? And part of this is because of the state and county health orders. We weren't going to move encampments. We're not going to abate them because the chances of spreading COVID throughout the community increase. And so that creates a challenge. And down at the Marina and Amphitheater, we've got a homeless encampment down there in the amphitheater. The Homeless Action Coalition, which is a nonprofit out of our city, is kind of coordinating. It's really focused on 19 people that are very vulnerable. County comes out and does regular COVID testing, really trying to provide some level of structure for folks that have been homeless in Martinez for a very long period of time. And it poses some challenges that we're gonna have to talk about because the problem itself is not gonna go away. And in fact, I think in some ways it's gonna get worse. We're just trying to figure out how we manage this and do the right thing for folks in our community and for our community as a whole. So that brings me to kind of where we are now. Even though the pandemic has caused everyone some disruption, and we have had to think through, how do we get past it? We can't lose sight of where we're trying to go and what those goals are. So for 2021, we're going to continue to push forward with some technology. We're rolling out body cameras actually this month. They'll be implemented in March, and that's been a project that's been ongoing for a while. Really happy that we're able to move forward with that. We're going to continue to develop an accountable and proactive and community-focused police culture. A big piece of that is based on a strategic plan that we've worked through that we're going to implement over the next 2 years. We're going to continue to recruit officers to enable staffing stability. That's something that we're always focused on. And I think if one thing that we've learned through this pandemic is we've got to be adaptive. We've got to be resilient as an organization, as a community, and we've got to be flexible because irrespective of what comes your way, you've got to be able to make changes in order to be relevant and continue to serve the community. And sometimes that just looks different than what you're used to seeing. And we've got to be open to doing that. So I think we've got some fantastic people in the city and in the police department that are really working towards making that happen. So thank you very much. I appreciate it.
Thank you, Chief. That was a great presentation. I would like to thank a few folks. I'd like to thank Shelby Taylor from Kaiser for being here with us today. Of course, the Chief of Police and the Martinez Chamber of Commerce. I'd like to also thank the major sponsors here today, the Contra Costa Board of Realtors and MCE, Marin Clean Energy. And my personal thanks to City Manager Eric Figueroa, Deputy City Manager Michael Chandler, Management Analyst Rika Goudry, who did all of the graphics for us today, and also Zach Seal, who's been working very diligently on our outdoor dining program and economic development. So I'd like to thank everyone for attending this virtual event this year, and have a wonderful day.